Hello everyone, I'm Dr. Amitha here, fetal medicine specialist from Apollo Cradle, Hyderabad. Today we are going to talk about a few common questions that I come across during my day-to-day practice. So very common things like, for example, first question or the most common question I get is when can we travel? So during the early stages of pregnancy, we usually advise patients not to travel at least till around 3 months of pregnancy. And after that, even if you do have to travel, we would advise against long road journeys. We would prefer a flight, if not maybe a train. But I think in those situations, the criteria has to be how accessible is healthcare to you if you have an emergency. It's better to try to avoid long flight journeys, but if it has to be done, and in fact for any journey, it is important that you stay very well hydrated and keep moving your legs. The calf muscle needs to be activated, so just keep moving your foot up and down. That keeps the calf muscle active and keeps circulating the blood. Second question that we often come across is patients often complain about a pain in their groin region, a very sharp pricking pain when they change position or when they turn from side to side. This is most commonly a ligament pain. So you can see it in the image that we have here. This is called as a ligament pain because there is a structure called as a round ligament which holds the uterus in position. So when the mother changes position, there is a stretch because of the growing uterus. This causes that pain. The next thing that we will talk about is about diet, most important. When we say healthy diet in pregnancy, we mean a high protein diet. It is very important that the mother stays very well hydrated. We recommend around anywhere between 2 to 3 liters of water a day. And when we say healthy diet, people come up with things like, I'm eating a lot of fruits, I'm having juices every day. Fruits give you vitamins. Fruits give you fiber, but there is no protein. Our typical Indian diet is very high on carbs, but sorely lacking in protein. So you need to supplement or step up the amount of protein intake. Please remember, when protein powders are prescribed, each scoop contains about 6 to 8 grams of protein at the most. The requirement for any person, daily requirement, is about 1 gram per kg, which is like, let's say, somewhere between 60 to 80 grams a day. So still the requirements are not met unless the diet per se is modified to include more of protein rich foods. The other thing we can talk about is about movements. The first initial movements that a mother feels is theoretically between 19 to 22 weeks. But I find that most first-time mothers are not able to perceive movements very early. By the time most first-time mothers recognize that it is a fetal movement is somewhere around 21, 22 weeks, which is totally fine. There is no time limit where you have to feel the movements by this time. The initial movements will be very faint, flutter-like sensation. It might be a little difficult to even identify if that is bowel movement or whether that is a fetal movement. As the pregnancy advances, the movements become stronger, become much more perceptible. The women might be able to even see wave-like movements on the abdomen. And it is not required to start counting movements from the 4th, 5th or 6th month of pregnancy. That can be done in the later stages of pregnancy. And there might be days in early pregnancy, like around 23, 24 weeks, when you might not feel as much movements, or you might feel like there is no movements at all. Please just drink a glass of water, sit down in a quiet place, eat something, and then just observe for an hour. You will most probably feel something. If you do not feel any movements, please do not panic. No harm in coming to the hospital and just getting the heartbeat checked or getting things checked. Most of the time, it is normal. It is not an issue. It is very common during this period between till around, say, 28 weeks, where there is a lot of variation. So it is okay to sometimes not feel movements on a regular pattern, or there might be more movements one day, no movements the other day. It is okay. But again, if the mother feels that it is not the usual pattern, better to get it checked.